So I was told by 4 different specialists that we would never be able to fall pregnant, and that if we were to, we would either have a miscarriage, a ectopic pregnancy, or a stillborn.
Because I didn't get excited straight away about the pregnancy. Like, of course I was excited, but I didn't want to get myself too overexcited just in case we lost the baby, and then it would be, I guess for me, easier to handle.
He would say when we were trying to get pregnant, it was a case of, well, it's your fault we're not pregnant this month. It's your illness that's causing this.
I think within the first 12 months, I was told that my endo was so severe that if I didn't have a child by 26 or 27, I would be unlikely to.
Yeah, we had 6 miscarriages altogether across, trying to have our babies.
I've had 9 pregnancies, but only 1 viable.
I had 6 miscarriages. I had a miscarriage at 3 months before I had my son Lachlan. 3 more miscarriages in between Lachlan and my daughter.
After trying for about 12 months, we decided that IVF was the right way to go for us.
And it took 5 years to have my son. 5 years of IVF to have him.
Said we would be more successful with IVF, and that was something that we weren't keen about, so we'll just leave it. At least we've got 1 child and we're happy with that.
I very luckily fell pregnant naturally without any assistance, and it was the month before we were going to try IVF.
As soon as we stopped tracking and stressing is when we fell pregnant.
Did an embryo transfer in November, knowing that we were getting married in January, and then announced that I was pregnant with our first child as part of our wedding ceremony.
My best mate has offered to be a surrogate, so that's a pretty big thing. And plan E is to adopt.
What I was asked to talk about was what I guess I call fertility fitness, which is essentially looking at lifestyle factors to protect and promote fertility. Life is wonderful and it's unbelievable so how it happens at times. I know we're in a situation often where it doesn't happen, but if you're interested here, this is what we all look like when we're about a day old. So this is a fertilised egg, which is the largest cell in the body, sitting in the fallopian tube. I think lots of people think the tube's a bit of a drain pipe that things go up and down on, but you can see it's actually a very complicated structure. And to get pregnant, in a sense, is not, at one level, isn't complicated. I mean, the basic things that we need is obviously, firstly, the woman needs to release a healthy egg into the fallopian tube. We need a certain number of normal, healthy sperm. And I think a lot of people don't realise that only about 4% of sperm actually need to look like that, our traditional picture. There's a lot of very odd sperm out there, as you can see. Their genetic material is essentially the same. And the other very important thing for sperm is that how many of them know where they're going to. So we need always at least 32% of sperm to be going from A to B, not taking the scenic route. And that can be a problem sometimes. Thirdly, of course, we need the egg and sperm to be able to meet in the fallopian tube. Here we have, you see, the largest cell in the body, the egg, which is meeting the smallest cell in the body, the sperm. And yet really it's unbelievable that both of those 2 cells will make an equal contribution to that child. I am going to be making some emphasis on the importance of that and the importance of the man half in terms of making sure pregnancy happens as quickly and easy as possible, thinking about that women tend to get the diagnosis of endo and then they feel that this is something that they're carrying the entire burden of the couple having issues. And then, of course, you need to have no barriers to an embryo hatching out and implanting in the uterus. This is a 1-day-old embryo, and that happens, and that embryo and sperm have met out at the end of the fallopian tube. And at that point, we're actually only 1 cell. And the interesting thing, you can see around the outside all these other little sperm that have tried to get into the egg but haven't made it. And then within 4 days, that embryo will be in the uterus, and you can see now it's become hundreds of cells in just that 4 days. And it's already starting to separate into the placenta, which is the outer bit, and what we call the inner cell mass, which is the baby. So those are the things that we need to get pregnant, and therefore we need to look at some of the lifestyle factors, things we can do ourselves to preserve and promote that. Now, we know on average that humans are not that good at getting pregnant. We only have at best about a 20% chance of getting pregnant in sort of normal circumstances. I mean, if you're a farmer and you were farming something that only had a 1 in 5 chance of getting pregnant each month, I think you'd give up. Fortunately for us, sort of it continues, and part of the evolutionary importance for us is not to be getting pregnant too easily, because you can imagine in hunter-gathering days that would start to sort of be a problem if sort of pregnancies happen very quickly, particularly with the issues of maternal death and bleeding. So an estimated time to get pregnant for a couple, no problems, is 4 months. But if you add in just one fertility parameter, you're down to only a 5% chance in that month. So that's a 2-year time to get pregnant. If you have a couple of things like endometriosis and some sperm issues, for example, then you're looking on average in a natural conception of taking 7 years to conceive. So therefore you really want to be minimising as much as possible the things that might happen. And though there have been lots of work on fertility, and IVF was mentioned in the video, but really it's taken a long time for people to recognise that lifestyle is a very important factor that reduces fertility for both men and for women. And also, if you don't pay attention to that, you will reduce your fertility options into the future. So the first lifestyle factor which weighs on people's mind in practice is age. I know it's not sort of the vegetables and things, but in practice the impact of age is still, as you know, very much placed on women. And yet, as we know, the egg is only half the baby. The man's sperm contributes an equal genetic amount. It might look tiny, tiny in the pictures, but it's still sort of very important. And so therefore we need to pay attention to what that might be doing to a woman's fertility. So here I just want to sort of emphasise one of two very famous studies looking at the chance for a 25-year-old woman getting pregnant in relation to her partner's age. Now, we all know there's lots of reasons why we'd like to be getting our sperm from Brad at this point in time, okay? And I have to say one of them is because your chances of getting pregnant are very good. On average, you'll get pregnant in 4 to 6 months. But as Brad's getting a bit older and more worn, getting into his mid-30s, 40-odd, then it's going to take you double that time. It will take that 25-year-old woman a year on average to get pregnant. And if things are going really downhill, I mean, this is 40 or above, so he's looking pretty old for 40 there. But on average, that 25-year-old woman will now take 2 years. Nothing's changed with her at all. It's all been related, I'm afraid, to Brad and where he's been going. And this is another sort of study that came out that's very important. And basically what they were doing was looking at the chance of pregnancy, sort of timing, and also in relation to the woman to the man's age. And the important one is this one here. So if we look women 35 to 39, if they were partnered with a man who was the same age as them, then their chance of getting pregnant was double that if they were partnered under the red bar with a man who was 5 years older. So when you think of the fact that in this country, and in most cases, women on average have a partner who's 2 to 3 years older, you can see that when women are having difficulties or people talk about putting restrictions on women because of their age, they're completely ignoring some very good research that's been around for a long time that makes it clear it's not just women. The other important and interesting thing, which this study has shown as others have, you can see that in actual fact the maximum time to conceive was actually 2 days, if intercourse was 2 days before the day of ovulation. So I know there's lots of things and everyone does their sticks and they're worrying, is the day, and this is the day I'm ovulating and we should be getting pregnant then. And movies love to show people who ring their husbands in the middle of the day, come home, I'm ovulating now. Okay. So we know an egg actually lasts for a day. That is why there is some urgency. But sperm on average is at its best for 2 to 3 days. And you can see, and this is not the only study, that in practice having intercourse 1 to 2 days before the day of ovulation is actually, if you're going to be having limited times to do it, is actually the best time. There are things in the seminal fluid that we believe help prepare the lining of the uterus. So that pressure that sometimes couples trying to conceive put on themselves, must know the day, must know the day. It's really, if it's within 2 to 3 days, that's going to be fine. So why is that change sort of that happens with men? Well, basically, it's because of sperm DNA damage, which increases in men's sperm from mid-30s on. And the interesting thing is that we know that eggs, like sort of all good mothering things, are actually able to repair some of that DNA damage in the sperm. But we do think that maybe that ability to repair it decreases with a woman's age. So that's why if she's got a partner who's accelerating his DNA damage ahead of where she is, that might be more difficult, looking at why there's the difference if your partner's the same age as you or not. We also know that good egg quality can't compensate for poor sperm DNA. So looking at Brad when he was 40-odd, that 24-year-old, she still couldn't make it. It took much longer for her eggs to deal with that. And the other important thing to know is that basically we now know 50 to 80% of men who are experiencing fertility problems in their relationship will have increased sperm DNA damage. So this was the group in which lots of unexplained infertility was put in before. And just to briefly say, what is DNA damage? Well, this is a sperm. You can see that the DNA for the sperm is very tightly packed in there. The sperm, to be able to do what it does, loses much of its supportive mechanisms. So once the sperm leaves the testis, it's actually much more sort of liable to actually sort of have damage if environmental things are happening. It's normal that some sperm will be like this, but above a certain number, it becomes a problem. And the other thing to think about relating to the video and that the couples were talking about the miscarriage risk is that, of course, the placenta is very much dependent on expression of genes from the father. So miscarriage risk is just as much related to sperm as the egg, as are genetic problems for the child. And for example, we know many of these genetic problems that come from the sperm can last into the child's adult life. So this was a study, this was done back in 2003, and yet lots of people still don't appreciate that when a couple are both 40 years or older, half the risk of Down syndrome comes from the father, not the mother. Now, moving on to another factor, nutrition, we know that there's a strong relationship between nutrition and fertility. And if we think in particular women with endometriosis, is there something that you should be doing specifically with your nutrition to improve things? This was a review that was done a couple of years ago, and overall they found that the evidence supporting a significant association between diet and endometriosis was equivocal. They did find that women with endometriosis did seem to consume fewer vegetables, they had less omega-3 polyunsaturated fats, and did seem to consume more red meat and trans fat. But the jury obviously is still out, and we don't really know whether potentially different nutrients can exert different effects at different times of the endometriosis development. A very important one in terms of nutrition, however, is iodine deficiency. Now, iodine deficiency has become very common in this country. 57% of women that I see for their first visit at Fertility First will be iodine deficient. And basically we have to blame these characters for it. So basically the Heart Foundation says don't have salt, and celebrity chefs say you must use sea salt. But of course that's not iodised. And in practice there's actually very few sources now other than sort of dairy unless you're using iodised salt or getting replacement. And if you don't have sufficient iodine, then not only is it harder to get pregnant, you're more likely to miscarry, pregnancy complications are higher. We now know that iodine deficiency is the commonest in pregnancy, is the commonest source of mental retardation in the world. And even milder deficiencies are associated with irreversible decrease in the child's IQ, 10 to 15 points. Now it's hard, what do you mean by 10 to 15 points? Well, I heard one of the iodine researchers say it's like the difference between working on a fishing boat and owning the fishing boat. That's the sort of difference you're talking about. And it's also linked to autism, which, as we know, is increasing. Vitamin D, another nutrient that's incredibly important. This is a study that literally just came out this month, so very fortunate. And it's looking at the chance of natural conception over 6 months for women who had low vitamin D compared to women that had an adequate vitamin D. And this was basically adjusted for all the things you'd think about: age, race, weight, smoking, etc. And you can see that if you had an appropriate vitamin D level, you were 50% more likely to get pregnant in 6 months than if you didn't. And this was another study looking at an IVF scenario, and you can see women that had better vitamin D levels had almost double the chance of pregnancy. Just that one thing alone, vitamin D levels, made a difference to whether they conceived or not. We know a lot of people are vitamin D deficient. These are the sort of numbers at Fertility First. There was a study a while ago showed up to 58% of people are vitamin D deficient. We have to blame the Cancer Council for that. They got so carried away with the slip, slop, slap, they actually forgot that there are another number of things like breast cancer, bowel cancer, prostate cancer, which are all increased in people that are vitamin D deficient. So normally, as you know, we get vitamin D from sun, but something not many people are aware of is that mushrooms are actually a fabulous source of vitamin D. You don't have to take the tablets. So like our skin, mushrooms can make vitamin D, but obviously they have to be grown in light to do that. So there are now mushrooms that you can get in supermarkets. Then the last bit of their growth, the growers expose them to ultraviolet light. And 3 to 4 of those mushrooms are sufficient to supply your daily needs. But you can also make your own. So I've got down here, so if you, this is a blog, so I'm assuming these are all going to be available afterwards, and you can actually look how to make your own vitamin D mushrooms, which is sort of quite a fun thing to do. Okay, and it lasts for about 6 months, so you don't have to make it and then consume them right away. And coming back to my concern about lifestyle and impact on the child as well, vitamin D deficiency in pregnancy is now very strongly associated with increased risk of multiple sclerosis, schizophrenia, diabetes, and has now been linked to autism as well. And so basically, it's obviously related to the amount of sun exposure the woman has in pregnancy. So if we look here, this is in Australia. If you're born in Tasmania, your risk of getting multiple sclerosis as an adult is 7 times higher than if you're born in Queensland. And that's now been clearly shown related to epidemiology. Folate, we know, is very important, and that's because we need it to break down this protein homocysteine. If we don't break it down, then we end up with things like neural tube defects and asthma in the child. But it's also important to remember that some people, no matter how good their diet, will still need some B vitamin and folate supplementation. We have a thing called an MTHFR gene, and if you have a variant of that, then it's much harder to utilise these vitamins from food. And this probably applies to both men and women, and probably about 1 in 8 of us are carriers. So you can actually look like a piece of broccoli and still potentially be folate deficient or B12 deficient. Smoking. Now, smoking is one of these good news, bad news things. It's good if you want to reduce your endometriosis risk, but it's not very good if you want to get pregnant. Okay, because basically endometriosis, being an estrogen-dependent disease, smoking increases estrogen breakdown. But unfortunately, it also makes you more infertile in other ways. So it's going to affect your eggs, it's going to affect your tubes and the lining of the uterus. And we now know that more infertility is attributable to smoking than tubal disease. So in particular, if you look at studies in IVF, a woman who smokes when she has IVF has effectively increased her age for that treatment by 10 years. So a 20-year-old having IVF would be behaving like a 30-year-old. And in terms of other factors, we know that smoking increases miscarriage risk 3 to 4 times. Ectopic pregnancy is more common. You're more likely to get an ectopic pregnancy if you smoke than if you had pelvic inflammatory disease in the past. And it also contributes to an earlier menopause by 1 to 4 years. Now, we already know with endometriosis, sometimes you're struggling with the number of eggs that you've got. So if you actually reduce them further, then that's actually compounding the situation. And the effects are dose dependent, i.e. the more cigarettes you smoke, the worse it will be. And obviously passive smoking is just as bad as if you were a smoker yourself. When we come to the child, this is a very famous paper, and basically what they said, as the title says, smoking during pregnancy is associated with adverse effects on the reproductive hormones, semen quality, height and body mass index of the children. So this in particular looked at male children. They found that basically a boy born to a smoker, 55% less germ cells migrate into his testes in adult life. So, and overall there's an earlier puberty. So basically if you're smoking and you're having a son, then your son is going to end up shorter, fatter and more infertile than if you weren't a smoker. Girls are affected as well, but not to the same extent. If men smoke, coming back to the DNA damage, It's very clear that that causes problems, and we know that children of men who are smoking at the time of conception have up to a 5 times higher risk of childhood cancers. And people have also shown some of that DNA damage can be seen in the grandchildren of those smokers as well, so it goes through generations. Alcohol, the good news and the bad news, or the good news if you don't have endometriosis, is that moderate drinking doesn't seem to affect fertility, but obviously higher amounts do. But unfortunately, if you've got endometriosis, it does. There is definitely evidence of a significant association between alcohol consumption and increased risk of endometriosis. So if we just look at these little green diamonds here, because they're on the right-hand side of the line, this is a meta-analysis, they're showing that whether you're infertile, fertile, or overall, your risk of having endometriosis or increased is worsened. And as we certainly know that it increases the risk of estrogen-dependent diseases, but it's unclear whether it exacerbates existing disease or related to severity. In terms of men and smoking, we all know the problem with alcohol, it's a disinhibitor. So the more you drink, the more you smoke. So therefore you're going to have that same DNA damage. And the problem is that disinhibition also leads to other risk factors that have impact on fertility, i.e. like unsafe sex and acquiring STIs. And obviously that applies to women as well. Coffee and caffeine, researchers have not been able to make a clear association. Overall, it's believed that you have about 200 to 300 milligrams of caffeine a day. That's okay. Don't forget things like cola have it in them as well. So that's up to a couple of cups of coffee. If you look at women with endometriosis, this was a meta-analysis done that showed no evidence overall between caffeine and coffee intake and increasing your risk of endometriosis. With men, we certainly know it affects DNA damage, so we're back to that same sort of issue. Men need to be thinking about things as well. One of the things, of course, is by then sort of probably your partners will be thinking, oh my God, is there anything left for me to do? Okay, you've ruined my life. Okay, I thought you came to an endometriosis conference. I didn't expect you to come home and tell me all these things. Okay. So, well, of course, there are other things that men can do to speed it up. So one of them is antioxidants. We know they're not that keen on tablets, but the other that does help sperm is frequent ejaculation, which might please them. So we know that after about 3 days, sperm do make the progression from here to here. So basically, if you're wanting to maximise sperm health and DNA damage, then ejaculation should be sort of 3 days previously. Weight, we all know that weight's a big issue. We know, however, it's a couple issue. If the couple are both significantly overweight, it can take up to almost 3 times as long to get pregnant. Moderately overweight, still about 50% longer. But the interesting thing is in 2 trials that have just been published, they looked at putting women who are significantly overweight, so we're looking at things like BMI over 35, and randomising them to a weight loss program prior to IVF. And interestingly, the women who did the weight loss program ended up with less babies than the women that went straight into IVF. And the reason for that probably is that the embryo is actually very good at sensing changes in the uterus. These are called epigenetic changes, and the concern is that maybe those embryos think they're going to be born into a time of famine and therefore sort of are less likely to hatch out and implant. A couple of final things before we finish. Just to remind you, particularly as pain is such an issue with endometriosis, you do need to be really careful about what pain relief you use mid-cycle if you're trying to get pregnant. So the pain-relieving tablets like aspirin, Indocin, Nurofen, they all have the ability to affect the release of the egg, leading to fertility issues. So the prostaglandins that they're blocking, that are causing your pain, are actually important for that egg to be released from the follicle. And in the studies that have been done, in 50 to 100% of cases, taking those drugs mid-cycle will actually reduce your ability to release that egg and get pregnant. And then with men, of course, the things they're most commonly likely to take are steroids, but unlike in sports or in sportsmen, steroids significantly reduce the performance and number of sperm, and for some men, that normal sperm count will never return. So to finish, I guess I'd like 4 messages. First thing, I'd just like to reiterate that it does take 2 to tango, that fertility is a couple issue, it's not just a woman's issue. And also, just because you've got endometriosis, that doesn't mean to say that whoever's looking after you fertility-wise shouldn't be looking and checking for these other things. You know, it doesn't mean if you've got endometriosis that your partner doesn't have a sperm issue, for example, or he needs to stop smoking, or you need to stop smoking. The second thing is when you're thinking about age, basically it's the age of the couple that matters, as you saw, not just the woman. And I think men need to be more aware that they can also run out of time in terms of maximising their fertility and their health of their child, and they should also be engaging in preservation of fertility strategies. Thirdly, I'm not going to go through all the things that I've said here, but just to remind you that the fertility factors promote fertility apply to both men and women. Then through some of these, it is possible to rejuvenate and reduce the impact of age on eggs and sperm, and also that the other all help not just with getting pregnant, but staying pregnant. And finally, I'd just like to remind you that though fertility fitness, so fertility factors, they are there to protect and promote fertility in men and women, but they're also going to protect and promote the health of the resulting child from birth into their adult life. Thank you.